I am deeply concerned, Mr. President, by warnings from leading health insurance companies and state insurance commissioners that the Trump administration is now deliberately undermining the Affordable Care Act, leaving insurance plans no choice but to sharply raise premiums or exit the marketplaces. Now, I understand, I think we all do, that the Affordable Care Act continues to experience stresses and that it needs to be strengthened. There's no doubt about that. I've been saying from the beginning that we need to correct what's not working, we need to keep what is working, and we need to work together to change it. But in 2016, there were abundant signs that the law was working and that insurance markets were stabilizing. For instance, in my state of New Hampshire, health insurance premium increases last year averaged just 2%. That's the lowest annual increase in history. Today, it is a very different picture. Because of the efforts of the Trump administration to undermine the Affordable Care Act, insurance companies in New Hampshire and across the country face widespread uncertainty. Many of them are deciding that they have no choice but to protect themselves by drastically increasing premiums. This week, there was a report in the New Hampshire Union Leader, our state's largest newspaper, that premiums in New Hampshire could increase by as much as 44%. Now, President Trump says that the Affordable Care Act is, and I quote, exploding. But let's be clear. If Obamacare is exploding, as President Trump says, it is because this administration lit the fuse and has been working aggressively to undermine the law. We can see in this poster what is being reported in other parts of the country. In the LA Times, we see health insurers and state officials say Trump is undermining Obamacare and pushing up rates. Health insurers plan big Obamacare rate hikes, and they blame Trump. Perhaps the greatest damage has been done by the administration's refusal to commit to funding cost-sharing subsidies, the federal subsidies that help millions of people pay for coverage. To protect themselves, many insurance companies are preparing two sets of premiums for next year. One premium level if the administration agrees to fund the cost-sharing subsidies, and a second, dramatically higher premium level if the administration says no to cost-sharing subsidies. Now, more broadly, the administration's mixed signals and erratic management of the Affordable Care Act are causing uncertainty in the marketplace. Paul Markovich, CEO of Blue Shield of California, has said that health plans are being forced to raise premiums to compensate for all the turmoil. And it gets worse. Last week, the Los Angeles Times reported that Seema Verma, the administrator of the Centers for Medicare and Medicaid Services, shocked a meeting of insurance industry executives by threatening to cut off funding for cost-sharing reductions unless insurers agree to support the House Republicans' bill to repeal the Affordable Care Act, the bill that was passed several weeks ago. Washington State Insurance Commissioner Mike Kreidler criticized the administration's actions as playing Russian roulette with Americans' health insurance coverage. He said, "This has," and I quote, "real impact on people's lives." One insurance company executive said this about the administration's actions, quote, "There's a sense that there are no hands on the wheel. They're just letting the bus careen down the road," end quote. Physicians and other healthcare professionals live by a time-honored pledge to do no harm. But the Trump administration is pursuing a course that will do tremendous harm to millions of Americans who have gained health coverage for the first time because of the Affordable Care Act. Unless and until Congress repeals the Affordable Care Act, it is the law of the land, and this administration has a responsibility to administer this law with fairness, with rigor, and with competence. The administration certainly does not have the right to take active steps to undermine or even sabotage the law, to threaten insurance companies with steps if they don't support repeal of Obamacare. It's time for the administration to reconsider its approach to health care reform. To date, regrettably, the administration's approach has been highly partisan, with no outreach to Democrats. Instead of a do-no-harm approach, instead of taking steps to fulfill President Trump's pledge that we're going to have insurance for everybody, and he came through New Hampshire multiple occasions during his primary campaign and during the general election campaign. And what he said about health insurance was that we were going to make sure everybody has it, we're going to make sure that they pay less and that they get quality coverage. Well, the administration now seems determined to take health coverage away from tens of millions of Americans. The Congressional Budget Office estimated that the House Republicans' bill, the first one to repeal the Affordable Care Act, would take coverage away from 24 million Americans. And yesterday, the administration proposed a budget that would cut Medicaid by as much as $1.3 trillion over the next decade. That would end coverage for millions of low-income Americans, people with disabilities, so many of our elderly in nursing homes, and in New Hampshire, where we are really on the front lines of the heroin and opioid epidemic, it would end treatment for so many people who are getting treatment for their substance use disorders because of the expansion of Medicaid. You know, when we think about the people who would be hurt by this, it's unconscionable to hear Office of Management and Budget Director Mike Mulvaney say, quote, "There's a certain philosophy wrapped in the budget, and that is that we are no longer going to measure compassion by the number of programs or the number of people on those programs," end quote. Well, I disagree with that view. By deliberately taking health care coverage from 24 million Americans, it shows the lack of compassion of this administration. And this isn't about numbers. He's right about that. This shouldn't be about numbers. This should be about people, about their families, about what these proposals will do to everyday Americans who will no longer have access to affordable health coverage, whether they have pre-existing conditions or whether they need to get treatment for cancer, for substance use disorders, or whatever their health care needs are. Under this proposal, they're not going to be able to afford it. Millions of Americans won't be able to afford it. I think there's a better way forward. Instead of tearing down the Affordable Care Act and taking health coverage away from people, we should be building on the gains, on the achievements of health care reform. And on that score, I want to share an extraordinary letter to the editor, written by Carol Gullah of Newmarket, New Hampshire. She writes, and I'm reading her letter, "I was in good health. Why bother with the physical? That was my mentality for years before the Affordable Care Act, AKA Obamacare. I work for a small nonprofit business, so we don't qualify for group health insurance plans. An annual physical wasn't included in the high premium, high deductible plans that were available to me on the individual insurance market, so they were often a luxury. But it was okay. I felt great. Why bother with doctors? Because of the Affordable Care Act last June, I went for a routine physical. During the exam, a lump was discovered in my breast. 10 days later, breast cancer was diagnosed. Fast forward to today. She says, I've just completed my final chemotherapy treatment, and my prognosis is very positive. That physical saved my life. Let me restate that. Obamacare saved my life. That crucial physical in June would not have happened had it not been an essential preventive service included in all health plans under the ACA. While not perfect, my insurance through the ACA is far better than anything available to me as an individual in the past. Ms. Gullah's letter continues. Up until this point, I've been pretty quiet about my diagnosis simply because I didn't want cancer to be the main topic of every conversation I had. But with the Republican majority in Washington, including Secretary of Health and Human Services Tom Price, promising to repeal the ACA, being quiet is no longer an option. I'm being asked to entrust my health and well-being to hollow promises of it will, and then she quotes, be replaced by something better. It will be great. Forgive me if I'm skeptical. This is my life we're talking about, she says. Don't tell me to be patient. Don't tell me to wait and see. Either outline a plan for improving the Affordable Care Act or leave my health insurance alone. And she signs it with her name, Carol Gulla, from Newmarket, New Hampshire. Well, I think we need to listen to Carol and to so many other people like her all across America. Instead of allowing this administration to undermine and even sabotage the Affordable Care Act, we in the Senate need to work together, Democrats and Republicans, to strengthen the parts of the Affordable Care Act that are working in the real world, including Medicaid expansion, and to fix what's not working. According to multiple recent polls that I've seen on this issue, this is what the great majority of Americans want us to do. It's time for us to listen to the American people. The Affordable Care Act has had a profoundly positive impact all across America, but it needs common sense repairs and it needs strengthening. Mend it, don't end it, and certainly don't sabotage it. This should be our bipartisan focus in the Senate. I intend to do everything I can to encourage such a bipartisan effort, and I know that my colleagues on both sides of the aisle would be willing to do this important work if they understood how much the American people want to see us do this. We know that the Affordable Care Act has had positive impacts in each of our states, including giving people peace of mind knowing they can't be denied coverage based on pre-existing conditions. So let's work together. Let's ensure that the Affordable Care Act works even better in the future for all Americans. Thank you, Mr. President. I yield the floor.